afternoon and welcome to the CEI presentation, S-CCATE, an essential 20 minutes. Today, Dr. Christine Mason, the Executive Director of the Center for Educational Improvement, and myself, the Director of Innovation and Research Support for CEI, will introduce you to S-CCATE and show you how to take the survey and manage it for your school. During today's web presentation, your microphones will be muted. However, you can use the chat to ask any questions, and you can also use the raise your hand feature if you would like to have your microphone unmuted. This session is being recorded, and we will put it up on the CEI website after this presentation. And if you have any questions, please do email me. My email is there, and we will send this slideshow out to you in an email.
So today you're going to learn a little more about S-CCATE. I know some of you have been to previous webinars that we've been conducting related to trauma and COVID-19 and what can you do as you go back to school. We really believe that the School Compassionate Culture Analytic Tool for Educators, that's the mouthful, the shortcut is S-CCATE, is something that will help you. It'll help you get organized, and it'll be helpful in terms of monitoring your progress and celebrating success. S-CCATE will help educators vision, plan, and monitor progress towards the implementation of compassionate, trauma-informed, or trauma-skilled practices in classrooms. And that means it works for elementary, middle school, young kids, high school, so across grade levels, across all sorts of conditions. Okay, next slide. So to begin with, this will help us. Could you just answer a brief poll? We want to find out something about your job and the type of agency you work for. So it looks like we have a mix of people, from teachers and school staff to school-based mental health professionals and other mental health professionals. Wonderful. And about 2/3 of you work for educational systems and 1/3 for agencies. So recently, we were in Maine virtually, doing some instruction and working with both schools and mental health providers. And a lot of the writing that we've done this last year really focuses on what can we do in a collaborative mode. So how do schools work with others, the community providers, to help support the needs of kids? So next slide. So we, in previous webinars, have talked more about S-CCATE itself. We've shown you the structure, the philosophy, the foundation. We've told you that S-CCATE was validated with a sample of over 800 educators across the United States. So that's one of the things that's very unique about S-CCATE. We want to give you a few sample questions and then spend most of the time today giving you a chance to actually take S-CCATE and then talk to you about the implications of the results you get. So you'll notice that items are structured with 4 levels of responses, from needing improvement to exemplary. Many scales are organized so that the level of proficient, level 3, would be considered the level that you want to aim for. We really encourage people to aim for exemplary. The reason being, sometimes when you think about the kids who are most at risk, they are the outliers. And we need to make sure that we're addressing their needs. So if you're hitting the needs of, say, 75% of your students, you can feel good, but you'll feel even better if you're up there with 98 to 100% of the kids. And that's what we're aiming for with S-CCATE. The items are arranged so you think about yourself as an educator, what you do, you think about your students and their capabilities, and you think about the community and the administration. So there's like 4 different ways of looking at the issues. And here are some examples of questions related to things that may be important today. Students are taught about the neuroscience behind drug or alcohol abuse. There's one example. Students regularly practice mindfulness as a path to build confidence. Students practice appropriate risk-taking. My classroom environment is structured to reduce the impacts of childhood stress and trauma. And I want to say we have some notes on our website about what we do now with the virtual learning or hybrid learning. And so you can think about your environment as what you set up. And you can think about safety in regards to what you do, what you have control over as you help to instruct students. So we are looking particularly with S-CCATE into areas such as mindfulness, neuroscience, neurobiology, equity, racial justice, and many items that may not be on more of the traditional school climate scales.
So now let me show you around the website. So this is scate.org, and in just a moment I'm going to walk you through how to take the survey yourself. But if you do come here or introduce the survey to someone else in your district or agency, there is a demonstration video that goes through the sign-up process. And also on the website is information about why people use S-CCATE and what it can help support. We also have the S-CCATE manual down here where you can learn about the validation study and more about how to use the survey to improve school and classroom climate. Also on this website, if you do happen to be in the New England area, we're offering S-CCATE for free to those schools. So you can learn more about our work with the Childhood Trauma Learning Collaborative and how to access the survey. There's also a great note from Dr. Mason about the value of S-CCATE, especially related to stress, trauma, and COVID-19. So this can be some information to take back to any decision makers at the district level to help them understand why S-CCATE is a package that can help with social emotional learning and trauma response. And once you do sign up for the S-CCATE, you'll be able to access the manager page. And you'll see something like this that will show you all of the schools to which you have been invited to be a manager. And at the manager page is where you get to invite the staff at your school to take the survey. We recommend that you take S-CCATE 3 times a year, right at the beginning, in the middle, and the end of the year, because it is a progress monitoring tool. So once you select the time frame, you're able to invite staff members right here by typing in their email addresses, copying them from an Excel document, or we can also help you import if you're doing it at the district level. We also have a new feature that allows you to schedule the invites to be sent at a certain date and time, which is really helpful. And if you are having other administrators help you monitor S-CCATE, you can invite them to be managers as well. And all of that, again, is explained on the home page in this demo video, and we are available to help you sign up schools as well. But for now, we are hoping that everyone can take the S-CCATE themselves. So I want to direct everyone to their own email inbox. Whatever email you use to register for this event, please navigate to that inbox, and you should see an invitation from S-CCATE with the subject line S-CCATE survey invitation. Go ahead and click on that, and you should see an email that looks just like this in your invite, inviting you to take a survey for the S-CCATE demo. If you don't have this email in your inbox, do check the spam folder. There are some firewalls that send this invitation to spam. If it's not in your inbox or in your spam folder, please put a note in the chat and we'll get that figured out. Now, for those of you who are able to navigate to this invitation, just click here and it will take you to the registration page, and you'll need to type in all of your information. And the password does require a capital, a letter, a numeral, and a symbol. So go ahead and come up with a password that includes all of those things. And then click the register button. And you'll need to log in using that same password that you just created. And it should take you to this page that says surveys in progress. If for any reason it doesn't take you to that page, you can navigate once you're logged in by clicking the survey tab on the left. And you'll see this survey right here, just click Start Survey. And you can go ahead and read a little more about the terminology and rating scale, which Dr. Mason just spoke about. And these questions with an asterisk are required, so you must complete those questions. And to get through to the end of the survey, you need to click at least 10 of these. This is a demo, so it will record your information not for your personal school, but for our demonstration purposes. So we'll give you about 12 minutes to complete the survey. We will be here to answer any questions you have. So please do come back early and ask questions, and then we'll wrap up giving you a little more information about the reports that your school will receive after you take the S-CCATE. And again, if you have any questions, you can either put something in the chat or use the raise your hand feature to get an open mic. Okay, I got a few back messages privately, and we're reaching the end of that 12 minutes. So I just wanted to show everybody how to access their own school survey if they are an administrator or a mental health service provider who has been made an S-CCATE manager. When you are logged in, you can come back to the home screen and come to this tab, Manage, which will only pop up if you are an S-CCATE manager. And when you sign into Manage, it will only show you your schools. So I would come to this and you click Invite Users to access, to manage what your staff has done on the survey thus far. At this page, you can see from the different time frames who has been invited to take the survey, who has been invited as a manager, who has already opened the survey and is in the process of taking it. If nothing is next to their name, then they have not clicked on the invitation yet. You can also see who has finished. It also shows you up here the number of open invitations, the number of invites that are scheduled, how many are in progress, and how many have been completed. You can also resend invitations from this page by clicking on the check mark and then sending another one. So if a teacher hasn't completed it, you can resend it to them and it'll be at the top of their inbox. From this list, when you have 7 or more who have finished, there will be a little button that pops up here that says Request S-CCATE Report. And so once 7 or more staff members have taken the S-CCATE, you can request a report, and in 2 to 3 business days, we'll turn it around to you. And I would love to show you some of the great new features that we have for S-CCATE reports. Oh, sorry. So we have some new features for the S-CCATE report. We've always been able to show you how your district or school compares to our national sample in the 5 different factors that S-CCATE measures, which you can see there on the left. But now we have even more information. We can show how each grade level ranked the 5 factors. So this is for our New England data set. And you can see that there is a difference between high school, middle school, early childhood, and elementary. So this can be useful information to see maybe which grade levels at your school are doing a great job with confidence, but might be able to learn from another grade level for understanding of equity. We also show you how people who identify from different racial backgrounds rate things a little differently by factor. We have the same information on different roles. So whether you're a general education teacher, an administrator, instructional aide. And then Dr. Mason's going to tell us about how wonderful the sample recommendations are.
So when you get your report, you not only get the bar graphs that Dana has just showed you, but you also get sample, or you get recommendations. We give you recommendations for your 2 areas that are the ones that where you have the lowest rating. We also tell you, of course, your areas of strength. From our prior work, we will be able to describe for you how your school rating compares to national, not only in terms of just the ratings, but in terms of what the recommendations might be nationally. And not surprisingly, the national recommendations usually include something about, let's make sure people understand about trauma. Let's make sure they understand about the neurobiology behind trauma, because we know that so much of the school climate and so much of social emotional learning is really related to alleviating that trauma. Another huge concern today is equity. So we have recommendations for equity. Our recommendations usually include a recommendation for professional development. So it's not just like you get the results and then we say, okay, go do something. We realize that oftentimes your school, your educators, your staff, outside agency people may need some professional development to help prepare them to implement. So there's a professional development recommendation and also a recommendation or several different recommendations for interventions. We talk about this as a teacher or educator empowerment tool because what we want to do is set things up so that people who get the results can look at the results and say, this is what we choose to do. You know, here are 5 or 6 different things we could do, but we choose to do these 1 or 2 things. If your organization or your school chooses to also get the action guides, what this means is you'll get more information from us. You'll get links to websites. You'll get more specific details in terms of what to do, both for the professional development and also for the implementation. You know, Dana, I could also say that after you go ahead and take the S-CCATE and get the recommendations, we recommend that you spend 2 to 3 to 4 months implementing interventions and then retake S-CCATE. Okay, and then you'll be able to get a comparison of the first time and the second time. What was the change in scores from time 1 and time 2?
I think we just wanted to invite you all to 2 more of these simulations. In the next 2, we're going to go into how S-CCATE can really be used to address trauma and the ramifications of COVID-19. And the last one, we'll be talking about how core learning teams can support this work as well. And please do contact us if you're interested in learning more about S-CCATE or bringing it to your school or district. And we also have a bi-monthly e-newsletter. It'll be coming out next week. So if you're interested in subscribing to that, please visit our website, edimprovement.org. And I think there is time for questions. If anyone has a question, you could type it in the chat or raise your hand and we'll unmute you. Or you can send us an email.
So one consideration is, you know, once you've taken S-CCATE, how long does it take to get results? And the way it's set up is you should be able to get the results within 2 to 3 days. So it's a very short period of time, which means, of course, you could take it now and have results by next week. And think about what that means for planning for this year. So it could be a huge help, particularly with all the stress that's really surrounding schools and surrounding everyone right now. You know, Dana, another question we sometimes get relates to, like, are we available to help? Is someone available in case you need help? And the answer is yes. And it, particularly Dana, but we also have Zach, who's with TeachLink. TeachLink is our partner, our technology partner that operates the platform for us. And they are available as well to help. So we have 2 sources of immediate assistance, and we are very responsive so that really, if you get to a point where you're interested and you think, what do I do now? Contact Dana and she'll give you the next steps. Well, I know school started today for some kids, and for others it was last week, and for some others it's going to be next week. So we want to thank you for joining us today. Wish you and hope that you will join us again, and then we'll see you in the future. Take care.